Different part of the UK has a different pathway on how they manage thyroid nodules. And in Newcastle, assessment of the biochemical thyroid function is very important to determine the pathway which patient is going through. If the patient had a biochemical test showing abnormal thyroid functions, they would be referred directly to the endocrinologist, and we then will decide the treatment pathway based on the diagnosis and also clinical evaluation of the thyroid nodule. Most of the thyroid nodule that produce excessive thyroid hormone is unlikely to be cancer, so the pathway is completely different. On the other hand, if the thyroid function is normal, the patient will be referred directly to the ENT department via their one-stop clinic, and they will get ultrasound and occasionally fine needle aspirations at the same time. Thyroid nodules are very common, and if you use a high-sensitive ultrasound, you could detect thyroid nodules in up to 70% of the population. However, it's only 5% or less of it turn out to be a cancer. Hence, thyroid nodule is something very common, and it's very important to find out if we truly need to follow up certain group of people. So if you have the ultrasound and the ultrasound define the thyroid nodule as benign, and you do not have high-risk features, then no further follow-up or ultrasound is required. And high-risk features are defined as if you have strong family history, for instance, a genetic condition that predisposes to thyroid cancer, like Cowden syndrome, familial thyroid cancer, then you need further follow-up. And the other possibility is if you are exposed to any radiation to your neck when you were young, for instance, childhood radiotherapy, neck irradiations, or you live in area exposed to nuclear accidents like Chernobyl, then you also need a little bit more close monitoring of your thyroid nodule. Another thing to note is young people presented with thyroid nodule, like less than 20 years old, those group will be more cautious and tend to offer follow-up scan. And again, you know, the interval of scan and how long we need to follow up is really based on individual risks and a kind of like a personalized approach. For thyroid nodule that's confirmed cancer, surgical removal remains the best and the most evidence-based option. For non-cancerous or benign nodule, then there are currently 2 non-surgical options to manage this problem. In the UK, we have ethanol ablations and radiofrequency ablations. Both are done by ENT and radiologists. And which method to choose is really based on the site, the size, and also the appearance of the thyroid nodule. For ethanol ablation, we tend to use that in kind of like the cystic nodule, where the cyst is only in a single or maximum 2 compartments, and ethanol ablation will be able to reduce the size of it of the nodule, and the nodule has to be 2 centimeters or larger. On the other hand, the radiofrequency ablation is a technique we use radiofrequency wave to deliver heat to the thyroid nodule with the aim to destroy it. And again, this method is only suitable for nodule that is at least bigger than 1 centimeter and smaller than 4 centimeters. And we only use it for, again, benign thyroid nodule.